Shirley Schantz is going to be talking to us about COVID. Shirley is a nurse, holds a PhD, and she's also a member of our leadership team for the Villages Democratic Club. So thank you, Shirley.
Can you hear me?
We can.
Okay, so just a little caveat or disclaimer. None of this is a substitute for seeing your primary care provider, or your doctor, or your nurse practitioner. So, and it's just an FYI. So, you know, we'll be looking at a few things. It's really important for people when you look at information on the internet. You have to be able to discern exactly what you're looking at. And for example, on this slide, this is from, I got this from CNN, but they get their information from Johns Hopkins, so I'm okay with that. And you really need to be careful about where you look at for information. So this is from Johns Hopkins. So you can go on the CNN website and you find this information, but this is Sumter County, which is, you know, where a lot of us reside. And what you really want to look for in this particular information is that so Sumter County had 12,000 cases so far. Cases per 100,000, but really want to look at is deaths per 100,000 and cases per 100,000. So you can't look just at the numbers. You have to look at how it is in relation to our population. So we've had about 215 deaths per 100,000 people in Sumter County, and that's important to know because that's about the rate that is in Florida, is 215 deaths per 100,000 in Florida. So that's a little bit high, but it's not the highest in the country. The highest is really New Jersey. So, but you can look at it and see what other counties are doing and how Florida is doing in relation to other states. And Florida right now is about 15th in cases and deaths per 100,000. So that's the kind of the number. And each county, you can get information for each county. So and understand that the Sumter County, obviously, is a great deal of the villages, but we're also obviously in Marion, which is much higher, and Lake County, which is higher too. So, so next slide. Okay, so this is just a little bit more of the same. The other thing that you want to look at in and when you look at this information is that the positivity rate, and if you look here, the positivity rate is 15.88%. There was a time when Florida, and this is for Sumter County, there was a time when Florida's positivity rate, it's been higher, it's been 20%, but it was down to 3.8% until the Delta variant came in. And now it's back up to 15.88%, which is kind of high. We really want it, I mean, ultimately, you really want it to be lower than 1%. So this is based on percentage, not on numbers. So it's not like you test more and you get more. No, this is based on percentages. And that's the kind of thing that you really want to look at. And fully vaccinated in Sumter County is 75%, which is pretty good. 65 plus population, the percentage of vaccinated is 87%. So we can look at Sumter County and say, okay, well, you know, the villages, most of us are some of us are 65 and older. And you can look at that in terms of, okay, that's pretty good. But you know, the virus really doesn't understand county boundaries. So anybody that comes in and out of the villages could be positive. And so we really still have to be careful. And even though Sumter County has a 75% fully vaccinated, we're still high. And the reason we're still high, we live in Florida. So Florida's high. So we get kind of clumped in with everybody else. So while It may make you feel better that 87% of people that are 65 and older are vaccinated. And so that's a good thing. But it also means that we can't let our guard down yet, because we're not, and herd immunity is kind of a number that somebody picked up somewhere. 70% herd immunity is better, but the Delta variant is so contagious that you really can't let your guard down at all. Okay, next slide. So we're going to talk a little bit about the booster. And let me see, there's some confusion, who should get it, who shouldn't get it yet, what's going to be available, which one do you get? There's all kinds of nuances. And so obviously you can read this and see who's really eligible to get the booster now. I will say that for some people have already gotten their third booster. So and it really it's almost serendipitous as to walking into Publix or Walgreens or CVS to get a booster. Now and it just, some places will say, no, you're not eligible because you're not immunocompromised and immunosuppressed. And other places will say, sure, we'll just sit down and we'll give it to you. So I have no inside information as to how you can get a booster. You can keep trying and just keep going. But after September 20th, the CDC is supposed to come out with definitive guidance about getting a booster. So, you can wait until September 20th to try and do that. I can't imagine, well, maybe I can or can't imagine after September 20th, we're going to have 160 million people trying to get a booster. So it might be the same kind of way that, we had to get vaccines in the first place, keep trying. And obviously, if you're unsure about whether you should get a booster, you can ask your healthcare provider. Now, some healthcare providers do have vaccine and will give you a booster, but that's really up to your healthcare provider. Next slide. Here's Amy put in some funnies. So a lot of people are afraid to go on cruises, and so that's just a little caveat there. Be careful. They're like petri dishes. So Florida's vaccine locator, you can go on. So this is one of my favorite sites to look at, and I cannot vouch for its total veracity, but it does have the information about where to locate a vaccine. In the Florida Department of Health website, you can sign up for a vaccine. Whether you will get it when you get there is still a little bit up in the air. So I will say that my husband and I have both gotten a booster shot. He is immunocompromised. I am not. I do not suggest that anybody say anything untrue on the form that they fill out. It's just, as I said, serendipitous. I think it's good to make an appointment because I think if you just show up, that's probably not the best thing for the people that are providing the boosters. My husband's immunocompromised, as I said. I'm not, but the pharmacist, it was in late afternoon, 5 o'clock, and he said, I have 2 doses left in the vial. So I either use up these 2 doses or I have to throw them out because once it's open, it's only good for 12 hours. So that's what I mean by being serendipitous. But you can keep trying, and be sure, though, that after September 20th, after the guidance comes out, you will be able to get a booster. Now, there is some places are giving crossover boosters. If you got Pfizer, you may get Moderna. If you got Moderna, you may get Pfizer. It all depends on what's available. There is no specific data saying one way is better than the other. So that's what you kind of have to look at. And hopefully on September 20th, we'll get more information about exactly, better guidance, because I don't think we've gotten such good guidance so far. But stay tuned, and everybody will eventually get a booster. And until you get your booster, you are protected. It doesn't mean that you shouldn't wear a mask and wash your hands and stay socially distanced, but you are protected. I think something came out yesterday that people that are unvaccinated have about an 11 times more chance of dying from COVID. And of course, we've all seen the anecdotal information that's been on TV about people taking their last breath and saying, I wish I had gotten vaccinated. So if you're vaccinated, you're okay. You can wait another couple of months. You will be fine. There are some breakthroughs. People do get sick, but you're still more protected, obviously, than if you didn't have a vaccine. Next slide. So this just shows you places. I mean, it's really just a visual of all the places in Florida that you can get a vaccine. So we really do have pretty good coverage in Florida. So there's not a dearth of places that you can go to get the vaccine. It's just going to take a little bit of patience, maybe a little diligence to get on the list and to get an appointment, but you will get a vaccine. Okay, next slide. So I just threw this in. This is kind of a little bonus thing. I wanted to talk a little bit, just mention HIPAA. Okay, so because everybody says, well, you can't ask this and you can't ask that because it's against HIPAA. Well, no, actually, and HIPAA, I mean, people take 3 credit courses to learn about HIPAA. So this is really, 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 it doesn't even reach the level of a Cliff's Notes about HIPAA. So HIPAA is HIPAA. It's not HIPPA, it's HIPAA. It's the Health Insurance Portability and Accountability Act of 1996. And it's a federal law, but it was originally started to protect your personal health information of what can be transmitted and what can't be transmitted. And when we started using emails to transmit and things like that, it was needed so that certain things could and could not be transmitted. And I know when you all go to your primary care provider, you sign away a form that says, yes, I understand HIPAA. And, it's like a whole page of, a 9 font. So I'm pretty sure people don't particularly read all that's in HIPAA. But the point is that, if I were to ask you, are you vaccinated? That's not against HIPAA. If you were to answer me if you're vaccinated, that's also not against HIPAA. What protects you is that nobody can ask your primary care provider about your personal health information unless you have agreed to that. So people can ask you anything. I could ask you if you're HIV positive. It's not against HIPAA. I can ask anything I want. And you can or cannot tell me, but I can't ask your primary health provider if you're HIV positive, for example. That would be against HIPAA. So it's just a little nuance about HIPAA, just for your own information about what you can ask, what people can share about their own health information. Personally, you can tell anybody anything you want. It just protects you from your health provider from sharing your information unless you have given permissions. And one of those things that you sign is saying, yes, I agree that you can give my health information to my insurance provider. And people do sign that away. And that's, that hopefully is okay. I mean, I don't, so far it hasn't come back to bite us too much, but we don't know about what's going to happen in the future in terms of health information, because it's becoming more and more open, let's say. But you have to sign a form, and so you really are in control of your personal health information. So that's about all I have to say. And this is if you really want to stay. I mean, this is nothing new. Wear a mask, wash your hands. People, that's the biggest thing forever, is to wash your hands. You can have COVID all over your hands, okay? That's where, and then if you touch your face, That's how you transmit it. If you are close to somebody with COVID and they cough or sneeze or breathe or yell at you or something like that, you can pick it up, but the mask will prevent that. So it's really transmission through the air into your on your face or your mouth or your nose, or transmission from your hands into your face, on your nose or your mouth. So if you wear a mask and you wash your hands, I mean, your hands could be full of COVID, but if you don't touch your face, you're okay. If you don't touch your face until you wash your hands, then you're okay. And so a lot of people don't realize how much they touch their face. So that's what you really have to do. And don't touch any handles or anything. Use something else when you open and close doors. Keep physical distance. So, 6 feet is, that's what they say is 6 feet. There's been some research done about that. So, but 6 feet's a good way. Cough and sneeze away into your elbow. So here into your elbow, not into your hand. Nothing about your hand. You have to follow your hands, because I can't stress enough. That's where it all begins, is in your hands. And that's why people have stopped shaking hands and things like that. And open your windows as much as possible, because the research has really indicated that being outside is a protector. If you're in a large group and you're all packed together, that may not be so much, but being outside is good. So if you want to go out and dine and you want to eat outside, fine. And I think that's all I have to say. Check on the Florida Department of Health website. You can look at a couple of different websites, but stick to just a few. And obviously don't go down the rabbit holes of what some people are posting on about COVID. And we all know about the ivermectin, and the latest information is about snake venom, and there actually is some basis to that. I'm not going to propose that people go out and get bitten by a snake, but that's where it's at. Oh, and I did want to mention, like, 10 seconds about Regeneron. It's a mononuclear antibody that helps prevent serious disease after you've been exposed or after you've tested positive. And there's one at Barnwood, and it's open every day from 9 to 5. And they don't require a lot of background information, but if you think you've been exposed or you've been tested positive, please, please, please check with your primary care provider first before you do anything. At some future time, I hope we can talk about the COVID-19 psychology. I think there's a lot associated with the virus. There's a lot associated with quarantine. There's a lot associated with social distancing. And so maybe at some future time, Mike, we can have somebody come in and talk about the psychology associated with this. Okay?
Thank you, Shirley.
Thanks for listening.
Thank you, Shirley.
Good evening. It's been nearly 6 months since the mask mandate went into effect here in New Mexico. As the governor encourages people to keep following the rules, News 13's Courtney Allen spoke with a psychology expert about the fatigue that is wearing on people. She joins us live from home.
Jess, experts say the more people see others wear masks, the more socially acceptable it becomes, developing into the norm over time, but it's hard to get everyone on board.
You've heard it for months. We have to do all of the work that we've been talking about. Wash your hands, social distance, wear a mask.
It becomes challenging to sustain motivation. The longer that we've been exposed to this, we just get tired.
Understandably, there is some fatigue. You see some people failing to wear masks from time to time, others outright defying the public health order.
People want to go back to their daily lives.
Dr. Tanya Reynolds at UNM says the main reasons people fail to comply is because the politicization of mask wearing, plus mixed messaging about their effectiveness and necessity early on.
There's also issues with feeling as though your autonomy, your own personal freedom or beliefs are being restricted because we didn't vote on any of these safety procedures.
Reynolds studies why people think the way that we do. She believes people may be more compliant if the emphasis was less on how many are dying, which she says may discourage people, and more on how many are saved when masks are worn and how many have recovered.
We aren't getting those positive boosts of reinforcement. You know, we're sensitive to reward and punishment. I think we need to keep hearing the messages as to why it's valuable and that it's actually quite a, pro-social thing to do.
She compared the pandemic to 9/11 that resulted in sweeping airport security changes nationwide that people adjusted to after watching thousands of Americans perish on live TV. With COVID, people just see the death toll numbers due to HIPAA, often not hearing the stories behind those numbers unless they're impacted personally.
If you haven't encountered anyone who's contracted the disease or who's really suffered from it, it's not going to feel like a true threat. If it doesn't feel truly threatening, then you don't have the same motivation to engage in those protective behaviors.
Dr. Reynolds adds it's psychologically easier for people to deny the threat of the pandemic and perhaps avoid wearing masks that are a reminder of it. Back to you.
All right. Thank you, Courtney. Dr. Reynolds says societal expectations are also at play. It says it is important to remind people that masks are not a signal of vulnerability, but a sign of protecting the vulnerable.